Nursing Theorist, Dorothy Johnson, by Jeremy Stressing. Hi, my name is Dorothy Johnson. I was born on August 21st, 1919 in Savannah, Georgia. I earned my Bachelor of Science in Nursing in 1942 from Vanderbilt University in Nashville, Tennessee. In 1948, I received my master's degree from Harvard University. I was an assistant professor of pediatric nursing, an associate professor of nursing, and a professor of nursing at the University of California in Los Angeles before I retired in 1978. In 1980, I published my conceptualization of behavioral system of model for nursing, where I explain my definition of the behavioral system model. The behavior system model of nursing. My theory defined nursing as an external regulatory force which acts to preserve the organization and integration of the patient's behaviors at an optimum level under those conditions in which behavior constitutes a threat to the physical or social health, or in which illness is found. I first proposed the theory in 1968. I explained that it was a way to foster the efficient and effective behavioral function to the patient to prevent illness. It stresses the importance of research-based knowledge about the effect of nursing care on patients. I defined the patient as a behavioral system composed of 7 behavioral subsystems: affiliative, dependency, ingestive, eliminative, sexual, aggressive, and achievement. Each subsystem is comprised of 4 structural characteristics. An imbalance in each system results in disequilibrium. The nurse's role is to help the patient maintain his or her equilibrium. Major concepts. I define human beings as having 2 major systems, the biological system and the behavioral system. It is the role of the medicine to focus on the biological system, whereas nursing's focus is the behavioral system. The concept of human being was defined as a behavioral system that strives to make continual adjustments to achieve, maintain, or regain balance to the steady state that is adaptation. Environment includes all elements of the surroundings of the human system and includes interior stressors. Health is the opposite of illness. It is a purposeful adaptive response, physically, mentally, emotionally, and socially, to internal and external stimuli in order to maintain stability and comfort. Nursing, which I have defined previously, is an external regulatory force which acts to preserve the organization and integration of the patient's behavior at an optimal level under those conditions in which the behavior constitutes a threat to physical or social health, or in which illness is found. Society relates to the environment on which the individual exists. An individual's behavior is influenced by the events in the environment. Defining each subsystem. 3 functional requirements of each subsystem include protection from noxious influences, provision for the nurturing environment, and stimulation for growth. Attachment or affiliative subsystem serves the need for security through social inclusion or intimacy. Dependent subsystem. Behaviors designed to get attention, recognition, and physical assistance. Ingestive subsystem. Fulfills the need to supply the biologic requirements for food and fluids. Eliminative system. Functions to excrete wastes. Sexual subsystem. Serves the biological requirement of procreation and reproduction. Aggressive subsystem. Functions in self and social protection and preservation. Achievement subsystem. Functions to master and control the self or the environment. An imbalance of any of these systems leads to a disequilibrium. As I stated, it is the nurse's responsibility to help maintain this equilibrium. There are 4 goals of nursing which are to assist the patient, whose behavior commensurate with social demands, who is able to modify his behavior in ways that supports biological imperatives, who is able to benefit to the fullest extent during illness from the physician's knowledge and skill, or those whose behavior does not give evidence of unnecessary trauma as a consequence of illness. Application of nursing research. Atefa Ganbari utilized my nursing theory in the case of an 11-year-old girl named Zainab, in the 1st grade of secondary school, who had been hospitalized in an infection center because of fever since 10/29/2016. This paper has been developed aiming to investigate clinical function of my behavioral model in the child suffering from acute lymphoblastic leukemia. Using my theory, they were able to develop a care plan that matched the patient's needs based on each subsystem. Further case study, although some words have been changed and added due to language barrier. Expected consequences from the care plan have been obtained successfully by the child with cooperation of her parents. At the end of a 10-day period of caring, Zainab made relationships with parents and the medical team staff, and her confidence has been increased as she is more hopeful about the future. She is interested in the field of law and would like to continue her education in this field. Zainab does her homework, her appetite has been improved, and there is no sign of aphthous, stomatitis, and mouth pain. The rate of platelets and white blood cells has returned to a natural range, and there is no symptoms of bleeding, fever, or infection. Zainab can do daily routines at the tolerance level. She can do her favorite games. After the care plan, the parents have felt more power and state necessary trainings while controlling fever, diet, and disease procedure well. Through designing a care plan based on my behavioral model, at the end of the 10-day period of hospitalization, Zainab increased confidence, improving rational skills, improving the appetite, life daily routines, no fatigue, fever, bleeding, and infection have been obtained. The existing problems in Zainab are the sign of instability in behavioral systems which need nursing intervention. Translating my theory into everyday life. Back when I was in school obtaining my first nursing degree, we utilized this model. Upon evaluation of each patient, we evaluated each system independently. This included each body system, but without even knowing we were incorporating the behavioral model. By assessing each body system, we were able to develop a patient-centric care plan based on their needs. We were able to assess their aggressive subsystem by understanding the root cause of illness. We were able to assess the achievement system based on their attitude regarding the illness. We were able to assess the affiliative system by assessing their interpersonal relationships and support systems. We were able to assess their dependency subsystem by observing how much assistance they needed. We were able to assess the eliminative system by observing their inputs and outputs, such as urine and stool, and assessing those specific body systems. We were able to assess their digestive system by observing their intake and their body systems incorporated with it. Lastly, we were able to assess a patient's sexual subsystem through asking questions that pertain to such. We use this system nearly every day within nursing without even noticing it. By understanding the body and understanding this model, we are able to develop a care plan that is based specifically on the patient at hand. Based on case studies, this model is shown to have had positive outcomes on patients. It helps us use our knowledge for our advantage and be the nurses we are meant to be.